Welcome back to Community Connection. Up next, we have Jonathan Andrews, Associate Vice President of Diagnostic Imaging and Ancillary Services for Sansum Clinic. Welcome, Jonathan. Thank you for being here.
Thanks a lot.
So let's start with you telling us about your role and your background. What led you to your role at Sansum?
Okay. So currently, as you said, I'm the Associate Vice President of Diagnostic Imaging and Ancillary Services for the group. Interestingly enough, I started about 22 years ago as a security guard in a very rural hospital in upstate New York, and I've worked my way up from then. So I've gained a lot of perspective doing all of the jobs along the way. Emergency room technologist, secretary, registrar, and I put myself through 3 degrees. So I have an associate's in athletic training, a bachelor's degree in nuclear medicine technology, which is my clinical specialty, and a master's in health administration. I've worked at a number of top-notch facilities, Massachusetts General Hospital in Boston, for quite a number of years. I was the operations manager for imaging services at Johns Hopkins Bayview Medical Center in Baltimore, and most recently at Kaiser Permanente Northwest as the regional director of imaging services.
That's amazing. What a career.
Thank you very much.
What is unique about radiology and imaging services at Sansum?
Technologically speaking, we do very well. We're at the cutting edge of all of our modalities to include CT, MRI, ultrasound, and mammography. But I think what really sets us apart is our team. We have a very dedicated and caring staff who do an amazing job at not just what they do technically speaking, but in caring for our patients. I think that's what really sets us apart.
That's great. I understand there are some new capabilities in women's imaging. Can you tell our viewers more about that?
Yeah, this is a big area in radiology nowadays. Women's imaging includes things like whole breast ultrasound, 3D mammography, screening mammography. We're on the edge right now of getting new 3D mammography at the clinic. We're shooting for that to be installed in April, and it's very exciting for us. What this will do is it will really help us to detect smaller cancers earlier in the process, and will help clear up any questions that the radiologist might have when looking at 2-dimensional digital mammography.
So how does that help move women's health forward in this community?
Well, it helps to care for them when we're looking for cancer specifically, much earlier in the process. So if we can identify cancers earlier, we can more effectively manage them as we move forward.
Sometimes you hear about a general concern about radiation exposure when it comes to radiologic exams. Can you speak to how radiology at Sansum addresses that for its patients?
Oh, definitely. I believe it was 2011, or a few years ago anyways, California Senate Bill 1237 required radiology sites to document how much radiation exposure a patient was getting for cross-sectional imaging in modalities like CAT scan. So we've progressed and are now tracking all of our cross-sectional imaging procedures, radiologically speaking, with how much dose a patient will get. So there's a concern about that for a lot of people, and what we're doing now with our CT scanners is we're working with physicists who specialize in radiologic imaging to manipulate our CAT scan machines to lower the dose, effectively lower the dose, so that patients are getting only as much as they need when they're getting their exams.
That's great. And what does the future hold for radiology and imaging at Sansum?
Well, we are really specializing in women's imaging, and we want to make sure that we have the technology and the training and the dedication to make sure that women are taken care of the way they deserve to be taken care of.
Are there technologies on the horizon that you see coming?
Well, I do. I haven't mentioned yet that we do have automated whole breast ultrasound, which is a complement to screening and diagnostic mammography. And like I said before, the 3D technology for mammography is really the cutting edge for women's imaging here at Sansum Clinic.
That's great. And as we wrap up today, do you have any final thoughts or anything that we haven't covered that you'd like to share with our viewers?
Well, we are in CAT scan, as I mentioned. We are bringing in a new 64-slice machine to the clinic. We brought that in, and we are currently looking at another one to complement that. These will be low-dose machines, cutting-edge technology.
And when you say 64 slice, can you clarify that for our viewers?
Oh, sure. Yeah, when we talk about slices for a CT scanner, you'll see 16 slice, 64 slice, 128 slice. And if you think about a loaf of cinnamon raisin bread, when you're taking slices through, if you take 16 slices, you might see a raisin, you might see a swirl of cinnamon. But as you have more slices, you'll see more detail. So these scanners can actually see a lot more detail than we would have been able to quite some number of years ago.
That's wonderful. Thank you so much for being here today and sharing all this amazing information about this resource we have in our community.
Thank you.
And thank you for watching.